Hi guys, welcome to another exciting episode of today's video. Today we want to talk much more about people who suffer from acidity. It's a condition that so many people have really suffered from, including young children, adults, elderly patients, and some of you have known how to manage it by yourselves at home. Others don't know, and most of the times you go to the hospital to get treatment for it. So can we talk today about acid, both in children and in adults? And by that I mean that we have got babies who do complain, especially the ones who know how to talk. I guess children above 3 years. There's some who are very clever, can be able to be complaining always about abdominal pains. And you notice that sometimes parents of these children or the guardian will just always assume that probably the baby is suffering from worms, or they're suffering from amoeba, because that's the best explanation they can tell you. They will tell you, my baby complains a lot about abdominal pain, and Dr. I'm not so sure what's wrong. So today let's learn with Esna, the clinician, and get updated informed that even small children, including the one born today, do suffer from a lot of acid production. So the only way, especially in young children, the neonates, you will know, is by they are going to be regurgitating milk the moment they breastfeed. You see them refluxing the milk, and it's curdy in a way, and it's sour. So this is because of they have high levels of production of acid. Now, acid in children can be normal, or it can be because of a very serious medical condition. And in this case, if it's a serious medical condition, that one needs medical interventions. But most of these acids that children have can be managed at home, and the only thing you need is to first identify if truly your baby is suffering from acid. And how will you do that? In fact, most of those children, they will complain about pain if they stay for long without feeding, or if they have taken a certain meal. Because even adults, in adults, they do tell you that after eating such and such a meal, I started experiencing abdominal pain, because they know how to say it, maybe burning sensation of the upper abdomen, which is usually, they will always indicate this side of the abdomen, which we call the gastrium. So you will see, for adults they will explain, but for children they will say just abdominal pain. So for you to know that it's not an infection that they have, especially food poisoning probably, you will see your child complaining of pain, but when they go for a long call, their stool is just normal. They don't have any other complaint other than that abdominal pain. So just observe. Number one, know when is the pain. Is it after the baby has stayed for long without eating, or is it after eating a certain meal? For example, those meals that can worsen the condition of acidic babies is if you fed on sukuma wiki, if you gave your baby rice and beans, fruits. There are fruits that can cause hyperacidity in children. Passion fruits, pineapples, itchy pineapples, mangoes, oranges. these are fruits that have acid. They are acidic in nature because they are citric acid fruits. So some children, if you give them that, you hear them complaining later after they are complaining of abdominal pain, but you won't be able to know, because sometimes we really don't know what causes what. So it will be so difficult for you to know that the fruit you give to your child is the one that is causing this kind of problem. Now, those things that we recommend that you do at home, especially for if it's a young baby, like an infant, and they are suffering from that kind of regurgitation of food once they feed, is wherever you put them on the bed to sleep, kindly put a pillow at the back of their head. This one will help to raise the upper part of the body so that it does not create gravity against food flow from the stomach up to the esophagus. In fact, if babies do have that kind of recurrent regurgitation, they are prone to aspiration. Aspiration, I mean, they are going to pour out the food content from the stomach, which is going to be directed the wrong respiratory system. Then they will be suffering from chronic cough and even pneumonia. We call that aspiration pneumonia because of the persistent regurgitation of meals from the stomach. Though, just like I've said, we have babies who will have that serious condition. You will see it during neonate period, that these babies have a persistent, anything they take, especially the breastfeeding. After breastfeeding, they are always severely vomiting. This might need intervention from a neonatologist or a pediatrician to see them, so that they can be able to do further investigation and see if the baby has another medical underlying condition. Now, for adults, themselves as well do know, at least they can explain to you or they can tell you how they are feeling. One of them is persistent chest pains, which we have seen some of you guys confusing with pneumonia. Anybody who has pain in the chest will tell you that I have pneumonia, and at some point you will realize that this pneumonia, you have treated it with some antibiotic at some point and you didn't respond. You stayed for a few days and the pain came down. So the pain is just centrally located in your chest. Sometimes it has burning sensation. You will feel some hotness there, and it radiates to the back. This one. Here. You feel your pain originating from this place. Then you feel it up straight to your backbone in the middle. Now, that is a condition that comes after too much production of acid, and it complicates to what we call GERD, which is a very broad term, which will take another whole lesson for discussion. So those guys who suffer with recurrent high levels of acid production do have some complications in life, and those complications can be as mild as they sound or as serious as they can be, because continuous burning of your stomach lining or continuous burning of your esophagus lining can lead you to get serious problems like gastritis or esophagitis, that's inflammation of the esophagus. Or due to that continuous burning, you can have erosion. Erosion means destruction of the lining of the esophagus and destruction of your stomach lining. And by doing so, you are exposed to bleeding. We have got people who have had issues with their acid production, coming, vomiting, serious blood. Others can even go into shock because of severe loss of blood. Others have been transfused because of too much loss of blood. Others have come telling you, Daktari, I can see black stool, because they are just bleeding internally, and without knowing, the blood, because it is mixed with digestive juices, they are going to see their stool being dark or brown. So that is one of the complications of severe acid production. Other things, because of that erosion and bleeding, you can get that you have perforation. Perforation is destruction or rupture of the lining and the blood vessels. So by doing so, you will see you for yourself having so severe, intense abdominal pains, which can lead you to get a very urgent or emergency operation to repair those problems that you have gotten. Another thing that someone who suffers from hyperacidity can have is, if you are not lucky as a patient who suffers from recurrent acid, you are one person prone to cancer of the stomach or the intestines. We have got one incidences, a few patients who have later on developed cancer of the stomach or cancer of the intestines. We call that, there are two of them, duodenal ulcers or peptic ulcers, which has it's a whole topic of discussion. So imagine then, sometimes wherever you are suffering from acid, you can be able to have what we call, sometimes you might have that pain on swallowing because of the burning, continuous burning of the esophagus and the throat, because literally you even breathe hot air. That hotness on and off persistently can cause that irritation, and you feel that wherever you want to swallow, you have pain. Another thing that acid can complicate too is hoarseness of voice. So sometimes you wake up in the morning, you hear that maybe you feel you are not talking the way you are used to, and imagine your sound, your voice is just hoarse, like it wants to disappear, coming back, or you cannot talk at all because of that acid production affecting the voice box. We say where the voice box lies because of that hotness that you breathe. So other people do suffer from chronic cough because of acidity, because with that irritation and dryness of the throat, so your body has that kind of reflex to coughing, because coughing is just a symptom. It tells you there's something wrong somewhere because of the irritation and the dryness, so you are coughing. So what I want to bring out here is that not every cough you have as an adult needs as well antibiotics or means it's pneumonia. You can have a cough, like for example those people who are suffering from hypertension, there are drugs that they are put on that can cause a cough, a persistent cough on them. Then there are people who have medical conditions like heart problems who will present to you with a cough. There are people who suffer from acidity that we are talking about earlier, who will come to you with a cough. Asthma patients or allergic patients, just like their counterpart children, will present to you with a cough. So it's a responsibility of the medical doctor or the clinician who is seeing you at that moment to do a very good history, to ask you so many questions relating to the type of cough that you're having, so that to get the specific cause of your problem and to treat as per the cause of your problem. This is why I insist that it's so better for you as the patient or the client to always seek medical attention from the doctor or the clinician near where you are. Let's always purpose to see the doctor, because I think these delays that we do by going to the chemist, doing self-medication, have put us in so much problems and danger and exposed us to so much healthy challenges, which if we took them to the doctor for examination and investigations, probably we might have discovered your problem earlier enough, get the right treatment or the right advice, because it's not always every condition you will take to the hospital that will require drugs. And it's not every condition you take to the hospital that will require the same drugs that you are used to. Sometimes you might hear that maybe you have been taking the wrong medication. This time, by doing a proper history and a proper checkup on you, we will require that, we will find out that your problem needs such and such a drug and not the ones that you have told us you have been taking. Yesterday I said that do not buy drugs from the chemist, especially the antibiotic. That one I insist, and I remain to insist, if you do not have a doctor's prescription, signed and stamped. But our patients who are suffering from, or the clients who are suffering from hyperacidity, sometimes they have seen doctors somewhere, so they are told you have a lot of gas or you have a lot of acid, so you can be taking such and such a medication whenever you are feeling this way. So probably because before you go to the hospital, you might have that drug in the house, so you can take. But for like those drugs that commonly you guys take, the antacids, those one you can buy for 1 day, 2 days, then for relief, as you go sort yourself with your doctor or the clinician near where you are. So always, like we have said, those things that aggravate acid production, sometimes you guys know them, but some do not know. That's why they are still doing them each and every day. So for example, there are meals that you can take while at your house, and without your knowledge, you won't be knowing that these meals can expose you to serious acid production or one thing or another. So those meals include, there are people who take sukuma wiki or kales, like we call them in science, and this sukuma wiki makes them have a lot of heartburn, a lot of burning sensation, sometimes a lot of gas. So if you have such a kind of problem, once you eat a certain meal, you should stop, because it is going to worsen your condition. Other things that we recommend is like those meals that you should not eat so often, especially if you are one person who has this condition always, is beans. As doctors, we recommend that you can take yellow beans. Yellow beans, even if you are taking it, you do not need to, you have to soak it overnight probably, or throughout the day. In the evening, you pour out that water, put fresh water, cook them. That's, for me, that's the advice I usually give, and it works for most of my patients. Then after you boil or you cook them, clean them again with clean water before you fry them. So put a little bit of onions and some little bit of tomatoes. Don't put too much, because even them, they can aggravate the acid production, so you put a little bit. Other things are spicy food, like pilau. Pilau is the major one, because pilau, most people love it. So if you eat pilau and you are a person who suffers from hyperacidity, you are going to suffer more because of the spices. So all the spices we tell acidity patients not to take, including Royco, which is a common ingredient in most kitchens, and most mothers love it because it has that flavor, and it makes your food taste good. So Royco is one. And another thing that we are going to talk about is coffee or sour milk. Some will tell you to take yogurt, but for me, I believe yogurt is fermented milk. So if we can say sour milk or sour porridge is bad, same as yogurt, but you can do once in a while probiotic yogurt, that's natural yogurt, because this yogurt has that normal flora, bacteria that is in this GI system that is good for your health, so it can balance the pH, especially because of the persistent irritation of the acid. So you can it will act like a probiotic. So it helps in wound healing and the mucosa lining healing. Other things that you cannot take are fruits like pineapples, because them naturally and literally they are acidic, mangoes, oranges, and any other citric fruit that you think of as that bitterness or sour taste in it. So those ones can also aggravate your condition. And our advice most of the time is try to eat small frequent meals. Do not sit in one sitting and eat to full. So if you're eating, you're in your plate, make sure you eat at least 3/4 of that meal and leave a quarter of it, so that in the next hour or 2 hours you are going to snack to replace the portion that you left on the plate when you were eating lunch or supper. So now in the evening, we advise that these patients should not eat immediately and go to sleep, because if you do so, those lumps of food, that because during digestion process, the tongue will roll the food into balls, and the more you swallow, your stomach will be full. Those lumps, before they get broken down by the digestive juices, if you go to sleep immediately and you are so full, you so much make your body, and during the night, even the metabolism rate is very slow, because even the brain is at rest. So that's why we advise, if you can be able to take a light meal in the evening, at night, that's better even. But if you are going to take a meal, just take a meal earlier, like 2 hours before bedtime. So if you take your meals at 7, then that means you sleep at 9. If you sleep at 10, you take your meals at 8. If you sleep at 8, you take your meal at 6. So that's what we mean. So that at least you give your body and your stomach time to do the breakdown of that food, so that wherever you lie down, you don't regurgitate the food content from the stomach up back to the esophagus for you to get a problem and those pains that you experience. Another thing, on lying down, we advise as well, whenever you lie on your bed, make sure your upper part from here up is a little bit raised, like someone who is propped up in bed, like you are almost seated, because that by doing so, it's going to help you create some gravity. Again, you stop creating gravity against milk, because if you lie flat on your bed, the food, you create gravity, then the food will flow so easily back to the chest. But if you lie supported on the upper part, your food will settle in the stomach for it to be broken down. So that said and done, those were the simplest ways that you can be able to manage your acid while at home before you can be able to take yourself to the hospital. For the cough, it's because it's caused by acid, you need to manage the acid for it to go away. So no antibiotic use in cough associated with acid. If we find out that you are suffering from, because there's another bacteria that is notorious in acid production, which I have forgotten to remember to talk about. H. pylori is a notorious bacteria that is found to be causing, in majority of patients, a lot of acidity. And this bacteria, sometimes we associate it with family history, or you can get it from contamination of food or water that you drink. So once you come to the hospital and you tell us that you have burning sensation, abdominal fullness, maybe utter constipation, and you have that throat irritation, pain, and you are coughing, we might ask you to do for us H. pylori, because its management is so unique as compared to other diseases. Because for it to, if it's there and if it's positive, it's given antibiotics for 2 weeks, then you take other drugs for another 1 month, depending on how you are responding. Then it is repeated for a check to be sure it's eliminated. And that bacteria is treatable if you do follow the doctor's instructions well. So my main reason why I'm doing this video is for you guys to educate you on the reasons why you should go to the hospital to see the doctor for your own good. Because it's so easy for them to discover a condition earlier and get treated for it before it can go. It can cause a lot of problems to you, and it can complicate to a very serious condition that you might require a lot of resources to treat. Until next time, I'm so grateful for your time, and I want to welcome you on our next videos. Continue supporting us. Kindly, wherever you are watching this video, don't forget to subscribe, like and share. Thanks for your time. Ciao. See you next time. Thank you.